Hi, my name is Tristan Francisco, and this is my assignment on the misconception toward concurrent disorders that places a strain on the mental health care system. Concurrent disorder is a term used to describe a condition where a person has both mental illness and a substance abuse problem. These individuals require more complex care in comparison to those with single disorders. Individuals with concurrent disorders are surrounded by constant misconception that places a strain on the mental health care system. These misconceptions result in stigma toward their diagnosis, a lack of appropriate care specific to their diagnosis, and vulnerability to further harm. Without clarity and understanding surrounding concurrent disorders, recovery is hindered. Both mental illness and substance abuse are continuously scrutinized by society, creating a stigma that has become one of the greatest barriers for individuals living with concurrent disorders. This stigma stems from a variety of things, but one factor is the media's influence on public perception. People with concurrent disorders are often portrayed as violent, dangerous, weak, and unpredictable. News headlines typically feature violent acts by people with mental health conditions and rarely feature the opposite. Studies suggest that people are significantly more likely to have negative attitudes toward those dealing with drug addiction than those with mental illness. People generally do not support resources that benefit those dependent on drugs, such as insurance, housing, or employment policies. The public is more likely to think of an addiction as a moral failing than a medical condition. However, drug abuse is often symptomatic of mental illness. Because of this stigma, many people have experienced lowered self-esteem and become unwilling to seek help in fear of what others may think, resulting in isolation and delayed access to help. Expanded public education to change our negative opinions and attitudes about addiction is a first step. Recognition of this growing problem may help more addicts get the support and treatment they need to start the path to recovery. The combination of substance abuse and mental illness enhance the negative effects of each other. For example, substance abuse often makes mental health problems worse. Substance abuse can mimic or mask the symptoms of mental health problems. Some substances can make mental health medications less effective. When a person relapses with one problem, it can trigger the symptoms of the other problem. A person with concurrent disorders will often have more serious medical, social, and emotional problems than if he or she had only one condition. Treatment may take longer and be more challenging. Two significant difficulties surrounding the treatment of concurrent disorders are that individuals are often treated for mental illness and substance abuse as separate entities, or are only treated for one out of the two disorders. However, people with concurrent disorders benefit significantly through integrated treatments that target both disorders simultaneously. Integrated treatment is a way of making sure that treatment is smooth, coordinated, and comprehensive for each client. The treatment plan needs to be customized. This means it will address each client's particular needs. Both the substance use and the mental health problem will be addressed with the most appropriate approaches from each field. Without correction, individuals are at an increased risk of relapse and further harm. Individuals with concurrent disorders are also at an increased risk for an assortment of harmful life-altering outcomes, including loss of social and familial relationships, recurring hospital visits, and suicide. An important aspect of integrated treatments consists of an effective screening process to determine the correct combination of the concurrent disorders exhibited by an individual. Research has shown that there is a direct correlation between problem gambling and concurrent mental illness, which is also linked to suicidal thoughts and attempts. It is integral for all individuals with concurrent disorders who are having problems coping with their condition to have access to the appropriate supports to better their lifestyle. This can be achieved by enhancing the mental health knowledge and awareness of the frontline staff who are in charge of developing the integrated treatments, increasing the general awareness of concurrent disorders in society, and ensuring that all communities have access to the integral treatments locally. Correcting the problem at the source can help eliminate these misconceptions and allow individuals living with concurrent disorders to live a satisfying life. Thank you for listening, and I hope you enjoyed my presentation.